Small thoracic vertebra. And that's it. So let's look at the from the skeleton here. So it goes like this. This is the external vertebrae. We have the nuchal line. Okay, the upper cervical vertebrae, thoracic vertebrae here, and what else? So this area is the origin. How about the insertion of this muscle?
Three parts.
So we have three parts: the superior part, or the descending fibers part, and then we have the middle, and then we have the inferior or ascending fibers, right? So the superior or descending fibers attached to lateral border of the or lateral side of the clavicle, which is the clavicular part, and then the other is the middle fibers attached to the acromion, right? And the inferior fibers attached to the right, the spinous process. This is the spinal part of the trapezius. Okay. So the clavicular part, what's the function of the clavicular part? It elevates, right? It elevates, right? And then we have the the clavicular part. What does it do? The clavicular part. It
Upward rotate.
okay. So basically here, it flexes the arm. Okay, everybody can say it. What is it? The clavicular part. Flexion. Right, slightly flexion, right? And slightly internal rotation.
Medial.
Right, medial rotation. The acromial part?
It's abduction, 15 degrees exactly.
Retract the scapula.
It retracts the scapula, okay? It retracts the scapula. The spinal part depresses the scapula, okay? It pulls it downwards. As you can see, so the acromial part pulls it medially, retracts, pulls it medially on the inside. The spinal part, okay, so the lower part or the ascending fibers would pull the scapula downward, retraction and downward, like depression. Okay, so we have three functions of the trapezius. So what's the nerve of the trapezius? Spinal accessory nerve. Okay, and so what's the injury? If we have an injury of spinal accessory, what happens? Okay, so basically. So this part of the shoulder plus the clavicle, it basically it goes down a little bit. Okay, so it depresses. So you would have a drooping of the shoulders, okay, and muscle weakness and so forth. Right. Okay, so that's that. So that's trapezius. Okay. So which muscle next is levator scapulae, which is this muscle here. Okay. The origin of levator scapulae is what? Upper thorse transverse process of the cervical vertebrae, and attaches to the angle of the scapula here, right? Right, and function is what?
Elevation.
Right, it elevates the upper border of the scapula, and the lateral border basically rotates down. Okay, it goes like it rotates down. Okay, the lateral border. So it elevates, and the lateral border is rotated downwards a little bit. Okay. Okay, so that's it. And then we have rhomboid minor and major. Rhomboid minor is what? It attaches to. Well, what's the origin of rhomboid minor? C7, C1. Right. Right. So it comes from the C7. C8 and T1, right? Is that correct? C7? T1, right. And then it attaches to the medial border of where the spinous process starts. Okay? So, and then rhomboid major, again same. T2, T3, T4, T5. And attaches to the medial border, lower medial border of the scapula. So both of these, basically, which pulls the scapula medially. Okay, so this is the insertion point, and these are this is the origin point. This is the insertion point. So insertion would move towards the origin, so it would retract the scapula, all your shoulder medially. Okay, just like the trapezius. Okay, so these three muscles are innervated by which nerve? Dorsal scapular nerve comes out from which segment of the spinal brachial plexus? So which does it come out from the trunk or the cords or the terminal? Is the terminal branch?
It's from the root.
From the trunk.
It comes from the root, right? It's dorsal scapula is from, say it again, which segment, which level?
Root.
Root, but which root?
C5.
C5, only C5,
C4,
not
C5.
No, C5.
only C5. Okay. Dorsal scapula, if you look at the, I'm sorry.
In the brachial plexus, it's in the brachial plexus, it's only from
Now, if you look at the brachial plexus,
Yeah, it's just from C5.
only from C5. So it's so from the upper root we have dorsal scapula and one nerve that comes out from the upper root. Which nerve is that?
Long thoracic.
Long thoracic nerve, right. So we have C5, C6, and C7 is long thoracic, but the other nerve is dorsal scapula. That's only C5. So from instance, and then we have next nerve. We have the upper trunk, the superior trunk. Which nerve comes out from the upper trunk?
Muscle cutaneous nerve?
The superior trunk.
Muscle cutaneous nerve?
No, superior trunk of the brachial plexus. We have
Lateral.
suprascapular nerve, isn't it? Right, suprascapular nerve and nerve to subclavius. Those two nerves come out from the upper trunk, the superior trunk. You don't know that? Okay, who's going to explain the brachial plexus after lunch? Who else? Okay. You're not answering my questions. Okay. All right. So dorsal scapula. So dorsal scapula innervates which muscles? One.
Dorsal scapula.
Dorsal scapular nerve innervates which muscles?
Major and minor.
Rhomboid, minor, major, and levator scapula. Three muscles. Okay, let's say it all together. Dorsal scapula innervates three muscles. From superior to inferior. One, levator scapulae, rhomboid minor, rhomboid major. So which muscle can we see that? Oh, those muscles here? Okay, so this is the rhomboid minor here. This is the rhomboid major. And here is the levator scapula. So these three muscles, okay? All right. So basically, we've done with that. So which... And then we have latissimus dorsi muscle, which is this muscle here. Which is this muscle here, latissimus dorsi. Okay. The origin is what? Lower six thoracic vertebra, the spinous process. Right, you have the iliac crest, you have the aponeurosis, thoracolumbar fascia, iliac crest, and then goes up, and inserts to intertubercular groove. So it goes under the axilla. Okay. So what's the function of that muscle? It's also referred to as swimmer's muscle, right? You swim. So the function is basically when it pulls the insertion, so it would extend a little bit, it would adduct, and slightly it would medial rotate. Okay, and that's how you would swim. Okay, extension, medial rotation, and adduction. Okay, medial rotation.